Hi, my name is Mark Hill, and I am the traveling NP. I'm a board certified family nurse practitioner, and I work locum tenens, and I also have a small rural clinic with myself, my nurse, and a receptionist. Um, Today, I want to talk about a subject that is a very common disease process that we as primary care providers see in the clinic almost every day and treat fairly routinely, and that is the subject of high blood pressure or hypertension. I guess starting any discussion based on high blood pressure or hypertension, we need to talk about what normal blood pressure is. Normal blood pressure in an adult male or female is blood pressure that does not exceed 120 over 80. Your systolic pressure is a maximum of 120, and your diastolic pressure is a maximum of 80. And people who aren't familiar with how blood pressure is taken, that is a measurement of the arterial blood flow. And you'll have two separate numbers, a top number and a bottom number, based on the contractions and resting pressures of the arteries. Now, I won't go into a lot of detail about the patho and the physiological parts of blood pressure, but mainly I just want to give a brief overview of what hypertension is. So, normal blood pressure for an adult male or female would be any blood pressure of under 120 over 80. Now, so what that tells me is any blood pressure above 120 over 80 is considered elevated blood pressure. So if you have a blood pressure that consistently runs 125 over 85, that is elevated blood pressure. Now that's different than hypertension or high blood pressure. Your blood pressure is elevated. It is above the norm of 120 over 80, but it's not necessarily hypertension. Up to 129, systolic blood pressure up to 129 is considered elevated blood pressure over 80. So your blood pressure in the average person on a daily basis fluctuates almost on a second by second basis. You're depending on what you're doing, your mental strain, your physical strain, your stress level at the time. If you check a person's blood pressure 40 times during the day, you're likely to get 40 different numbers. Specifically, if providers have ever worked in an emergency room setting or an ICU setting, if you've ever had a chance to watch an arterial line blood pressure monitor, watch the waveform on that monitor, and you'll notice that those numbers associated with that waveform, it's usually a red waveform, will change almost on a constant basis. They'll change every 2 to 3, 5 seconds. There's never a constant set blood pressure ever. Now, what you want is that blood pressure to maintain a certain range most of the time. So I want my average blood pressure, my average normal blood pressure, to be under 120 over 80. So if your blood pressure becomes elevated, in other words, your systolic pressure becomes 120, then you're moving towards, or due to the stress level, you've got an elevated blood pressure. Stage 1 hypertension is blood pressure that exceeds 129 on the top, or your systolic pressure, and exceeds 80 on the bottom. So stage 1 hypertension is blood pressure that's 130 to 139 on the top and 80 to 89 on the bottom. This is stage 1 hypertension. Now, you don't always get treated for stage 1 hypertension. If you come into the clinic and I have 2 or 3 blood pressures on you that are stage 1 hypertension. Let's say your blood pressure, you come in, your blood pressure is 135 over 85, 135 over 89. I'm not necessarily going to treat that with a medication. I may suggest that you make some lifestyle changes, exercise, lose some weight, some things that you can do to decrease your blood pressure, decrease your salt intake. That may be the best treatment for you at that time. And also, I have to remember that there is what's called a white coat phenomenon, where people's blood pressure becomes elevated because and when they go to the doctor's office. So you have to take those things into consideration as well. So if you've got a person that's worried about their blood pressure and they bring you in a list of blood pressures that range from 120 to 125 systolic, over 75 to 80 on the bottom, when they're at home, and they're taking it 2 or 3 times a day at home, but when they come to the office and you see a blood pressure that's jumped up to 135, 136, a lot of times I'm going to chalk that up to white coat syndrome, being under a little bit of stress, maybe they're a little bit nervous, and I'm not going to jump right into a treatment plan with them. Now, when you start moving into consistent stage 2 hypertension, where you're consistently coming to the clinic and you've got blood pressures that are running 140 over 90, and every time you come in, you've got a blood pressure that runs somewhere between 142 and 150 over 90 to 95, and let's say your pressures at home are running 130s over 80s, then, and we've tried other things to modify your blood pressure, then I'm more inclined to begin a person on blood pressure medications at that time. A lot of that will depend on their age, how long we've been dealing with pressures like this, and then of course you get into more severe cases, stage 3 and stage 4 hypertension, where you're sometimes having to use more than one medication to control blood pressure. And typically, if I get to the point where I can't control a person with 2 blood pressure medications and they're still very difficult to control, I will sometimes, depending on how out of control they are, let's say they're moved up into stage 3 hypertension, say 150 over 100, 155 over 100, something like that. And I've got them on 2 medications. I can add a third medication maybe, depending on their situation and how compliant they are, and get that pressure down into the high 130s, 140s, and kind of maintain that. I may not refer them at that point. But if I've got a patient that's running blood pressures 160s, 170s, even persistent 150s, and I've got them on 3 medications, and I'm still not able to really control those blood pressures, I tend to refer those people to blood pressure specialists, which these are usually internal medicine people who specialize in controlling difficult to control hypertension. So high blood pressure, I think a lot of people misunderstand what the difference between elevated blood pressure is and high blood pressure. My mother walks around with a systolic blood pressure of around 98 over 50. That's her normal blood pressure. She's never taken a blood pressure pill in her life. I walk around with a normal blood pressure of 140s over 89. So because of years of doing that, I take a blood pressure medication. Each person's blood pressure is going to be different, and it's going to be specific to them and the situation that they're in. But if your blood pressure is consistently running over 130 systolic, and especially over 90s on the bottom, it's something to be concerned about. It's something to take into consideration when you're trying to control your health and to make improvements to your health. And ways to control your blood pressure is, of course, taking your medication, which is a big, gigantic factor. losing weight, even 5 to 10% of body mass lost in dieting can affect the blood pressure significantly. It has been proven in most patients. Decreasing your salt intake, those things help. The truth of the matter is that primary essential hypertension is not well understood. There's a lot of environmental and genetic factors that go into what causes a person to have primary or essential hypertension. We've gotten pretty good at controlling it, but we don't really fully understand the reasons for it. High salt intake can contribute to it, but that's not the only thing that that causes high blood pressure. A lot of times it's just genetic factors. Secondary hypertension is hypertension that's caused by something else, maybe by another medication that you're taking, by an illness, by an underlying disease process that you did not know you had. And finding out what causes that secondary hypertension is key to the treatment of that type of hypertension. So, in review, normal blood pressure, anything under 120/80, as long as you don't drop so low that you're hypotensive, which for the average adult would be under, say, 90. If you start running in the low 90s and you're symptomatic, or under 90 and you're symptomatic, then there's a problem, underlying issue that you need to deal with. A lot of times it's cutting back on certain medications like blood pressure medications. Sometimes people can have problems with blood pressure medications and it causes their blood pressure to be too low. And that's no good either. So up to 120/80, that's normal blood pressure. So if you've got a blood pressure that's running 110/74, perfect blood pressure. If you got a blood pressure that's running 125/78 or 80, still pretty good blood pressure. It's a little bit elevated, but what's going on to cause that pressure to be a little bit elevated? Are you in the middle of your workday? Are you under a certain amount of stress? Is there something going on in your life that may be causing that blood pressure to be slightly elevated? It may jump up to 130/140 at the doctor's office if you're stressed out because you have white coat syndrome. So keep all those things in consideration. You can't walk into the clinic and me take your blood pressure one time and me know for sure what the problem is, or even if you have hypertension. I may have a one-time value that's elevated, and then we may go from there and say, okay, well, you need to get to the blood pressure monitor. If it looks like your blood pressure may be elevated, we need to start monitoring our blood pressure a couple times a day or a few times a week. We need to have adequate follow-up. We need to discuss treatment options, non-pharmacological treatment options for blood pressures that are say below stage 1 hypertension. So those are all things that we have to take into consideration when we're working in the primary care setting and our patients come in with elevated blood pressure issues. Of course, blood pressure is a huge problem in America because it causes so many other problems. And I've got another video that kind of delves into that. It causes heart disease, congestive heart failure, which is one form of what heart disease is, a broad term. It can cause kidney problems. It can cause hardening of the arteries. There's just a lot of issues. Stroke. There's just a lot of issues that hypertension, high blood pressure can cause. So it's important to make sure you get treatment, follow up with your primary care providers, and make sure you take your medications. Anyway, this is Mark Hill, and I am the Traveling NP. It's good to see you. Till next time.